Hello, my name is Dr. Richard Ferkel. I'm a fellowship-trained orthopedic surgeon at the Southern California Orthopedic Institute, and I specialize in arthroscopic and reconstructive surgery of the shoulder, knee, foot and ankle, and sports medicine. In this video, I will be discussing chronic ankle pain after sprain. An ankle sprain is an injury to a ligament. A strain is an injury to a muscle tendon unit. Most people, when they injure their ankle with a twisting mechanism, will develop a sprain to one or more ligaments. These are fibrous bands of tissue that provide stability to the joint and can be stretched or torn from excessive force, such as a sudden twisting during sports, stepping on an uneven surface, or a blow to the ankle. Sometimes a sprain can occur at the same time on one side of the ankle and a fracture or broken bone on the other. However, most patients who twist their ankle suffer a sprain alone. The most common signs and symptoms of a sprain are pain and swelling, stiffness, and an inability to weight bear on the ankle. Most ankle sprains will resolve with RICE. That means rest, ice, compression, and elevation. However, approximately 20 to 40% of patients with ankle sprains may develop residual symptoms that last for months after their initial injury. These symptoms may include continued pain, catching, locking, or feeling of giving way or instability in the ankle. In addition, the patient may notice swelling and difficulty ambulating or returning back to sports. If a patient's symptoms after a perceived sprain do not significantly improve within 1 to 2 weeks, then they should seek care with an orthopedic foot and ankle specialist. Sometimes, even seemingly minor injuries can result in severe internal injuries and even fractures to the ankle. Therefore, it is important that the patient be carefully evaluated with a history, physical examination, and at least x-rays. Conservative treatment can then be initiated that will help to lead to resolution of the patient's symptoms. However, if the symptoms continue, additional tests may be necessary. There are numerous causes of chronic ankle pain after an ankle sprain. These include injuries to the bone, cartilage, ligaments, and tendons. Sometimes more than one area may be injured in the ankle at the same time. Fractures can mimic chronic ankle sprain pain, as can tears to the surrounding tendons and ligaments. The most common mechanism for pain after a chronic ankle sprain is that scar tissue and inflammation develop on the inside and or outside of the ankle over the areas of the ligament tears, and these lead to persistent pain in the ankle with daily activities and sometimes with sports activity. Chronic ankle pain after a sprain is diagnosed by careful history, physical examination, x-rays, and if needed, an MRI scan to look at the soft tissues about the ankle. MRI is better to look at the soft tissues, while CAT scan is better to look at the bony structures. Occasionally, both are utilized to get the most accurate diagnosis for the patient. We may then also use anesthetic injections to localize the pain to the ankle or the joint below it, called the subtalar joint. It is important to make the correct diagnosis in each patient so that the appropriate treatment plan can be delineated and put into effect. There are a number of treatment options for a patient with chronic ankle pain after a sprain. Initially, their conservative treatment includes anti-inflammatories, rest, occasionally an anti-inflammatory injection, bracing, and physical therapy. If the problem is more severe, it may require immobilization in a boot or a cast. If the patient's pain persists after 4 to 6 months of conservative treatment, sometimes arthroscopic surgery using small arthroscopes and instrumentation is necessary to help alleviate the problem. These instruments are much smaller than those used in a knee, shoulder, or hip. This involves going in and looking at the interior of the ankle and seeing how much damage there is, since even MRIs and CAT scans have limitations to their accuracy. Many times, removing the inflamed scar tissue and torn ligament ends will alleviate the patient's pain. In addition, sometimes bone spurs or loose chips need to be removed as well. Rarely a cartilage injury can develop after an ankle sprain, and that needs to be addressed as discussed in our previous video on cartilage injuries of the ankle. If the patient has a more severe sprain with significant tears of the ligaments and or tendons, then these may need to be repaired as well. Each treatment must be carefully individualized to the patient's unique situation and injury. There is no such thing as a simple ankle sprain. Each injury has a recovery process determined by severity and the amount of associated problems. The The more mild or grade 1 ankle sprains usually take 2 to 4 weeks to recover with conservative treatment. However, the more severe cases can take up to 12 weeks. If the patient requires arthroscopic surgery, they are immobilized for a week and then go into a boot and start weight bearing. Gradually, they'll increase their weight bearing and walking in a brace or boot. At approximately 3 to 4 weeks, they start physical therapy and usually do not return back to sports for 6 to 10 weeks, depending on the type of injury and what is necessary to correct it. As mentioned before, I want to emphasize there is no such thing as a simple ankle sprain. It is important that the patient seeks appropriate medical care if their condition does not improve. In a number of cases, the injury may be more severe than the patient perceives, and appropriate diagnosis and treatment is needed to provide the best possible result. To learn more about chronic ankle pain after sprains, please visit our website at www.scoi.com. Thank you for your attention.